is Madeline York, and I'm the co-chair of the Leadership Breakfast for the Galleria Chamber of Commerce. We are at TIRR Memorial Hermann Hospital today to talk with and interview Carl Josehart, who is the CEO of TIRR Memorial Hermann, and who will be our featured speaker at our Leadership Breakfast on the second Wednesday of August at the Hotel Grand Duca at 7:30. Please join us.
Spencer was our founding physician, and he was actually trained originally as a pediatrician. And back at the time when polio was sweeping the nation, he really saw that there was nobody addressing the physical devastation of the children and adults facing polio. So TIRR started out as a polio hospital. As the cure for polio became available and that was less prevalent, he moved his work to working with individuals with cystic fibrosis, which was another area where there was great suffering, not a lot of medical intervention available at the time. And from there, the skills that he used to alleviate suffering and maximize independence, even with chronic illness, grew and expanded, and he became one of the fathers of rehabilitation medicine.
What is the working relationship between TIRR and Memorial Hermann?
So in 2006, TIRR and Memorial Hermann decided to join forces. And now TIRR is part of the Memorial Hermann health system. And that's really strengthened the care of the patients at Memorial Hermann and at TIRR. Because now I have access to trauma surgeons and neurosurgeons and neurologists and all the specialists that practice throughout the entire Memorial Hermann healthcare system.
Carl, will you tell us a little bit about your background before you came to TIRR Memorial Hermann?
Sure, it's a little bit of an interesting story. I started out my career as a clinical social worker. So the first 10 or 15 years of my career I worked with individuals and couples and families, providing counseling and therapy. And then later I was asked to be part of a work redesign at University of Chicago hospitals. And from there my career took a different turn and went into management and consulting. And then prior to coming to TIRR, I was the chief operating officer of a rehabilitation hospital in the Chicago area. When I started out my career, I was determined that I was only going to do clinical work. In fact, my dad was a hospital administrator and desperately wanted me to follow in his footsteps, but I told him that was never going to happen, and I'm sure he's looking down from heaven right now, just having a good time laughing about the fact.
Carl, why don't you tell us a little bit about your strengths and how you've developed those over the years?
Well, I think that my strengths are really come out of my clinical background, and that's really in assessing situations, diagnosing problems, developing treatment plans, monitoring progress, and then making adjustments along the way. When I first made the move from clinical to administrative roles, it felt very different until I realized that the work was the same, but we used a different vocabulary. So rather than treating one patient at a time, now my patient, if you so to speak, is the organization.
Carl, how do you develop leaders in your organization?
I was very fortunate early in my career to have mentors who saw potential and skills in me that I wasn't even aware that I had. And so what I look for mostly is critical thinking skills, the ability to build teams, the ability to move projects forward. Knowledge is something that can be acquired rather easily. So if there's a skill gap or a knowledge gap, someone can usually go to a course or read a book or an article. But if they're not able to work through other people, there's very little that I think they can accomplish.
Can you tell us a little bit about your vision for the future?
Well, I think that TIRR has always been a leader in innovation, and so I think we're looking forward to the next big breakthroughs. We're a teaching facility, we're a research facility, and in fact, in the next year or so, we're just completing a fundraising effort to open a freestanding research building on our campus to bring the researchers that we work with even closer to the patient care and the clinicians so that information flows more freely from the care of patients to the researchers and then back to the care of patients.